Hello, this is Dr. Pete Buckins from myfreedomquest.com. That's my website, and I'm broadcasting from Orlando, Florida. Today's video is on the recovery path. And I want to start out by listing some misconceptions about recovery which really hinder the recovery process. Recovery is difficult enough. We need the cooperation of the family members, the friends, of course the alcoholic and addict. But there are some misconceptions that interfere with the recovery process. The first one is the families normally think that if he admits he's got a problem, then he's going to be okay. The second misconception is that as long as we get the job back, or we get him back in school, or we get out of the legal problems, as long as he gets out of trouble, he gets back on the right path economically and employment-wise, career-wise, legally, socially, then things are fine. What's very hard to believe is that once a person admits he's got the problem, this is the beginning. And the person has to really accept that there's a problem so that he's motivated enough to take the action necessary to get into recovery. This disease is like any other disease. It has a path. People are relapse prone. There's a little bit of resistance to taking the treatment, just like a diabetic might resist taking the insulin, or a schizophrenic might resist taking the psychotropic medication, or a cancer patient might resist going to the doctor at first because of fear or resistance to getting into treatment. But anyway, once a person says they have the problem, that's the beginning. They have to spend a lot of time connecting the problems that the drinking or drugging caused to the drinking and the drugging. In other words, the legal problems, the emotional, mental, family, career, financial, physical. These are consequences of drinking and drugging, and they're not necessarily the priorities in early recovery. This leads to the second misconception that as long as we get the job back or the career back on path, or he starts getting up in the morning on time, or he starts acting a little bit nicer, or gets out of the legal problems or starts making money, then we're okay. Those consequences, the DUI, the legal problems, the problems with the marriage, the problems with the career education, those are really consequences of drinking and drugging, and they need to be addressed, but in time. Those symptoms are not the problem. They are symptoms or consequences. The problem is the cravings and the obsessive mindset that an alcoholic addict has that has to be addressed. And this usually takes years. Following the deep admission of a problem and the motivation to receive treatment for the problem, following that comes a long period of reconstruction where the person has to make amends for the problems they've done. Most alcoholics and addicts have an awful time admitting to the problems because of the guilt and the shame and the remorse. So you can see that recovery is not just an instant type of awareness or insight. The introspection is usually harmful. Addicts and alcoholics' brain has been damaged, and thinking is not very good, usually for the first year. And most people relapse if they ever get out of denial. So this problem really has a solution that the people in the 12-step programs understand very well. And I'm not sure there's many other places to go besides 12-step programs where you can really heal for long-term recovery. At any rate, you can reach me at 407-786-1913. That's my office in Orlando, Florida. And I hope this video was helpful. I hope I said something that impacted you and made sense and makes you want to try a 12-step meeting. Al-Anon is very good for the family, and AA is very good for the addict alcoholic. Thank you very much.